Taste the Mediterranean through March 19th at Whole Foods Market. Save on animal welfare certified bone and beef short ribs, sustainable wild-caught sockeye salmon, and more. Find sales on Parmigiano Reggiano, charcuterie and ground lamb. Grab an olive boule bread from the bakery. Plus, wines from the Mediterranean start at just $8.99. Taste the Mediterranean now at Whole Foods Market. Must be 21 plus. Please drink responsibly.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hi, Jess.
So today we are going to talk about poop. The clock is ticking, so let's get to it. So we know that, this topic sometimes makes parents a bit uneasy, but it is incredibly important. Stooling in infancy. So Anthony, how often should an infant poop?
So infants typically will poop with every feeding. And this is because every time food enters the stomach, that means it tells their body to empty the poop. And so it's rapid movement of the food through their colon. However, some kids, especially those who are being breastfed, may go up to a week without a bowel movement. So as long as the child looks comfortable, has a soft belly, eating well, and passing gas, there's not much to worry about. So it can be pretty variable in that way.
So what is normal stool consistency for an infant?
So stools may be soft, mushy, yellow, brown, or green. Those are the colors that we know are good. Breastfed infants may have more liquid-like stools, and that can resemble diarrhea. Sometimes there could be a little yellow with some spots of brown in them, while formula-fed infants have more formed stools. Transitioning from breastfeeding to formula, as well as transitioning to solid food, can also make the child's consistency be a little bit more firm.
Well, bon appetit, everyone. No, I'm joking. Hope everyone already ate their breakfast this morning. All right, Anthony, what are normal poop colors in infancy?
So when a child is born, they pass a black tar-like stool. That's the meconium. And it's really important they pass that within the first 48 hours. As the baby grows, so do the changes in their color of their poop, right? So normal colors, as I said, are yellow, brown, and green. Green stool is common because it's due to bile. And that means what happens is it's due to bile and it just goes through your child's system pretty quickly and it can stay green. But the ones you want to be more worried about are the red, black, gray, or tan. Those can be associated with a liver issue, while the black or red might suggest blood. So when in doubt, take a picture, bring a diaper to your child's pediatrician, and have them take a look at it so that we can make further assessments.
The number of pictures I had on my camera roll of my kids' poop is pretty astounding. All right, Anthony, so why do babies sometimes seem uncomfortable when they're passing stool?
So this is something we get all the time. And I remember when I was a resident, my mentor said to me, can you imagine yourself pooping while lying down, right? And that's what kids are doing. And it's really not a comfortable position. And when kids are trying to poop lying down, their pelvic floor muscles don't relax. And so they're trying to push the poop past that. And this is why they look uncomfortable. This is something known as rectal confusion. And it's typical in most infants and will resolve by 2 to 4 months of age.
I never really thought about the position. That does sound uncomfortable. All right, Anthony, so constipation is a concern for many parents. What signs should we watch for, and how can you tell if your baby is constipated?
So when babies look uncomfortable, if their poops are soft, that's rectal confusion. But when there's a change in their bowel movements in terms of frequency, where they have less stools than they normally do, or they're having consistency that's harder, or they're really having a lot of pain, and that pain can be associated with blood streaks, or they're not eating as well and you're noticing a change in appetite. If you notice these signs, then you may be more concerned about constipation.
So parents may be curious about exercises to help out their child if their child hasn't had a bowel movement. So what are some safe practices and what should we avoid?
So there are a few exercises that you can do, and what you're doing with these exercises is mimicking how poop will move throughout the belly. So abdominal massage, starting on the bottom right, working your way up, then across the child's belly and then down, will help mimic how poop and exits, and this may be helpful for your child to poop more regularly. The other thing to do is bicycle leg exercises, which helps decrease the tension in the pelvic floor, relax those muscles, and this can also help your child pass a bowel movement. What I try to avoid is rectal stimulation or suppositories. Sometimes you may need to do this, but really consult with your child's pediatrician, because sometimes if we use this too much, this can actually lead to your child only wanting to go when they get a suppository or you do rectal stimulation with a Q-tip. So occasionally prune juice can be helpful. We usually recommend this with some water and dilute that. But the most important thing is not to dilute breast milk or formula with water, because this is going to affect how many calories your child has, and the adding additional water can be dangerous.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.